Today, the topic is does and does not for the Barrett esophagus. Barrett esophagus is a condition in which the cells in the lining of the food pipe, as well as damage due to a stomach acid, which follow back into the esophagus due to gastroesophageal disease leading to changes in the cells of the lining. In the most of the cases, the Barrett esophagus due to reflux of the acids back of in the esophageal region, leading to changing the digit of cells of the lining. Patients diagnosed with Barrett esophagus are higher risk of developing esophageal carcinoma. If you have Barrett esophagus, some does and don't could help you reduce your symptoms. It's best to avoid foods and drinks that trigger the symptoms. Stay away from fried and spicy foods, high-fat foods like processed butters and meats and other food items like chocolates, peppermints. Also avoid drinks like citrus juices, coffee, teas, sodas, and alcohol. You should also avoid dairy products like milk and cheese if they trigger your symptoms. If some patients are no trigger the symptoms like curds, they may take curds, but most of the patients milk causes the irritation of the esophagus, so avoid the milk. Some sauce and higher acid content such as tomato sauce, mustard sauce, vinegar, hence these should be avoided. These foods can make symptoms worse and may lead to more discomfort. Some foods that you can consume to manage your symptoms include food high in fiber content and low in fat. These foods include fruits, vegetables, herbs, oats, beans, brown, etc. Also affect the symptoms of Barrett esophagus. So eat your food in a small proportion at regular intervals, multiple times a day, and avoid having larger meals. This will put less stress on your digestion and will reduce the risk of acid reflux. If you sleep immediately after eating food, it may again trigger an acid reflux. Hence, avoid eating food at least 3 hours before sleeping and sit in the upright position after having your meal. In India, most of the peoples have bad habits to take the meal at bedtime. Must be avoided. Try sleeping with the head of your bed elevated so your head is higher than your stomach. You can achieve this by placing blocks or weights under the bed frame, as this will prevent acid reflux. The patient diagnosed with Barrett esophagus who have the habit of smoking are higher risk of developing esophageal carcinoma as compared to those who don't take. This because smoking increases acid production in the stomach and makes the muscles at the bottom of the esophagus that separates the esophagus from the stomach weak. It also decreases the production of saliva, which helps to reduce the acid in the stomach. Hence, it is advised that these patients should quit smoking. Finally, the most common cause of Barrett esophagus is the acid GERD, reflux of acid. So avoid the fatty meal and do regular exercise regularly, and take most of the foods have more fiber content and less fats. Thank you.